more and more lately. Initially, I wasn't sold because I was primarily dealing with VPI, and VPI has gotten better, but the initial policies, there were so many loopholes that the insurance company can jump through, and a lot of exclusions, and that's just not the case anymore. They are becoming more competitive. VPI is still not my favorite, but it's doing a better job than what it used to, and a lot of people have those policies from long ago, and we're still working with them quite a bit. But I'm going to tell you about my personal experience. So this is not everybody's experience, it's mine. But so many people had so many questions, I decided to make a lecture about it. So a general overview, pet insurance is all about finances. So it's a financial investment into the health of your pet. People can either pay on a monthly basis or pay a year at a time, but it is all about affording care. It is a contract with a risk management company. It's a company, and they're only in it because they're making money at it. So overall, the general person is, on average, people in general are going to spend a little bit more for insurance than what the actual care would cost. But sometimes you really make off a lot better than that. And there's several cases we're going to go through today which have, and then I can talk about their siblings, which may or may not have benefited from it. The contracts are long. They're 10 to 20 pages on average, 15 to 16. You really need to read the whole policy. You need to know all the details. Everything is explained in that. And any claims that you have, you want to make sure you follow the rules and you know how to submit that claim. So read it over, know it well. As long as you follow the rules and the claims process follows the laid out manner in which it's supposed to happen, then you'll have success. The other thing that's very different between pet insurance and human insurance, they reimburse you for your costs. You have to pay the bill before they will reimburse you. So they're not insuring the care, the veterinary care. They're insuring your pocketbook. They're insuring your costs of care. And so you have to show that something is paid in full before they're going to cut you that check. So if you have a payment plan with an individual veterinary clinic, if that payment plan is 6 months, you have to wait 6 months to submit that claim, and then they'll pay you back. But it has to be paid in full. So this is a requirement. You have the freedom to take your pet to any licensed veterinarian for care. So it has to be. There are other therapies that you can get. You can go to a chiropractor. It can be a human chiropractor that can practice on animals. You can go for massage. You can go for Reiki. These things can be very expensive. Insurance is not going to help you with those things. Only if they're provided by a veterinarian. So if you have a veterinarian or a veterinarian that oversees a technician in their practice, then it will be covered.
Is there any sort of holistic care covered, say like Dr. Lankenau or Dr. Koenig?
Yes, because they're licensed veterinarians. Yes. And then wellness plans are also available. We'll talk a little bit about these. In general, I find that they're not financially beneficial. In this way, you are not insuring risk at all. This is not risk. It's going to happen, and so the reimbursement doesn't tend to be as good. You might cut even, if that, usually. That's my experience. So. Cost of pet health insurance. Insurance plans are meant to cover unexpected costs, and you want to try to tailor, what you can afford, and it's based on these things. You choose your deductible in a lot of cases, and you choose your reimbursement rate. So you may choose to have a higher deductible and a lower reimbursement rate. So say a $200 deductible and 80% reimbursement because it brings your policy monthly fee down to $15 a month. Versus if you choose no deductible and 100% reimbursement, those policies can be as much as $65 a month. And so making this workable, what can you afford in the incident of an emergency is where you come up with this number, and then the reimbursement rate, what you want to try to restock the bank account with after that event. And those things determine your monthly fee or your yearly policy rate. Plans vary greatly between companies. They're extremely variable. Deductibles can be per year, per problem. There can be reimbursement rates that can be 70% up to 100%. There can be differences between specialty reimbursement and standard or routine veterinary practice reimbursement. So you have to, again, read that policy thoroughly and know the ins and outs and pros and cons. I'm going to help you try to navigate the pitfalls of pet health insurance when you're shopping. So we have a list of questions for you to ask when you're looking around for that policy. We also have compiled policy rates for 2 typical pets, level 1 being basic emergency level care, and level 2 being emergency plus chronic medical condition care. We called around and went through that annoying long process of getting a quote to the top 5 companies that we encounter that we like for a 1-year-old Boston Terrier purebred female and a 5-year-old domestic short-hair cat. And we got those numbers, and that's what's on your sheets. Is we got their deductible options, we got their reimbursement rates, and what those policies cost based on those numbers. And so it's not every pet, and your pet would probably be different, but it is just a general idea of where to start from, what costs more, what costs less. So there are, those costs will help you determine where you want to call, what you want to do, but it will be different for your pet. I do want to put one note out there. When we were calling around, we were talking about a purebred dog. So purebreds cost more to insure than a mixed breed dog. We've got 2 dogs in the back there. They're both Morkies, Micah and Elijah. They are designer hybrid dogs. I love designer hybrid dogs. I'm not a breed purist. But they're cheaper because they're considered mixed breed. So their policy can cost 30 to 50% less than a purebred.
Is that what you say with cats or not?
Purebred cats are more expensive than your common domestic. Yeah. So purebreds cost more because they have more genetic conditions, but you know the reason is they're starting to cover congenital and genetic illnesses. They never used to. So that's becoming much more available. What pet insurance is not, these 3 look like the same thing, but they're not the same thing. Pet insurance is not a method of payment, so it's not a card that you hand over at the front desk that you can charge something on. You have to pay with your standard methods of payment, credit card, cash, or whatever, and then they reimburse you. It's also not free money. You're paying into it, and often you get out of it what you pay into it. If you're very proactive owners, and so definitely believe in the highest level of care, you're going to benefit from it. If you come in on day 1 or 2 of a problem, we're going to talk a little bit more about that. And it's definitely not a payment plan. It's not a way after a diagnosis to figure out how to pay for a surgery, cancer management. After a diagnosis, it's not, they won't cover you for that problem. And then it's definitely not a health guarantee. So just because you have the means to pay for better level care doesn't mean they're going to survive. Cancer is cancer. A lot of times we lose, but what we can do is extend their disease-free interval in a period of time where they feel better, and it can cost a lot. And insurance really, really helps with cancer. You can afford surgery, you can afford radiation, you can afford chemotherapy. They can live longer lives with disease and feel good. And so there's so much more available in veterinary medicine now than there ever used to be. And I've sent patients for MRI at neurologist centers more in the past 2 years than in the previous 9 years of my career combined. And a lot of those pets have insurance. Those owners can do it. What it's also not is a line of credit. Care credit is a line of credit. It's like a credit card for medical purposes. It's available at veterinary offices, chiropractic offices, dentist offices, human dentist offices, and some doctor's offices. This can fill that gap between payment and reimbursement. So it's often a period of time of financing interest-free. Most veterinary clinics accept it as a form of payment. Depending on the total cost, so if it's generally over $300, you might get 6 months to pay. If it's over $600, you might get 12 months to pay. Not usually more than that. That time is interest-free as long as you're not late on payments. You can opt for longer terms, but then they start to charge interest at 9 or 15%. So it's a credit card, but it is a little bit easier to get than other credit cards because it's for medical purposes, and that you can use it, the same card, at your veterinary office, at your dental office, chiropractic office, and other ways. But that's something that you may also get at a veterinary office. You can apply for it with us or with the veterinarian. Okay, insurance pros and cons. This is a long slide. I'm going to be talking about it for a while. Definitely the biggest pro is peace of mind, and the reason is right here. reduces the risk of a cost-based euthanasia. So if your dog gets hit by a car and it costs $8,000 to put Humpty Dumpty back together again, you don't have $8,000, your insurance will help you cover that. So it is something that allows you to have care when you otherwise may not be able to afford it, especially all in one big bolus. So that's why, another reason that I love pet insurance, I've come to love pet insurance. It gives you the ability to choose the best treatment options. So again, you may previously have not gone for that MRI of the brain when your dog had started having seizures, your cat started having seizures. It might be something that you're willing to do some baseline level testing for, but then you just wait and see if the problem gets worse, if there's a brain tumor or not. Now with pet health insurance, you've probably already met your deductible in doing those baseline tests, so it actually doesn't cost all that much more to go get an MRI. It's covered, and you can go see that specialist and have the neurology consult, and you can know if there's some additional treatment options. You might even, if you find a brain tumor, be able to go to Cornell, have the surgery, and be affordable for them. Most brain tumors are benign. They just occupy space in the brain and damage the surrounding brain tissue, so they can do quite well with surgery. These are things that our patients are having done now that they never used to, and a lot of them are having it done because they're insured. And so we're seeing a lot more complex cases in veterinary medicine, and this is one of the biggest reasons people have coverage for their pets. And then this is a big difference between human insurance and pet insurance. In human insurance, a lot of times you are required to try a generic drug before you can get a brand new drug. I ran into a problem myself at my OB's office. I had a generic drug, I had side effects I had to go through, but it was a giant hassle, and it took about 3 months to get approval for the drug that actually does work very well for me. I would have loved to have started because this drug has a notorious history of the generic being no good. And I would have loved to start with this, but you had to jump through this hoop in the human healthcare industry. This is up to your veterinarian. If your veterinarian recommends the brand name drug, the most common one, Suloxone. Thyroid medication, brand name. The generic is pretty close to useless. And there are a ton of hypothyroid dogs out there. So if we recommend the brand name for your pet, that's what they'll cover. So it's very nice to have this as an option. It's up to us, the veterinarian, which is nice. It's not up to the insurance company. And then most plans these days do cover hereditary and congenital conditions. Again, this is why policies for purebreds tend to be a bit more, but it can't be pre-existing. So it can't be diagnosed prior to the policy starting. So there are some congenital conditions that are going to immediately not be well covered. And it depends on your policy. There are some that will do certain pre-existing conditions, and they will be listed out in that 10 to 20 page document. If they cover umbilical hernias and their repair at the time of spay and neuter, or repair if you're not going to spay or neuter your pet, it will be written in there. So that's something you want to look into if you know your pet has a hernia and you want to get it repaired. It allows you to, this is something that Joanne, who helped me greatly with this event today, came up with the wording for this part of the slide. Allows you to keep your medical dollars invested in local business. It is beneficial to the practice, obviously, if you're taking better care of your pets, because you're investing in that care and your bills are paid. And we don't have a lot of money sitting out there in limbo waiting for someone to pay their bill. So it definitely helps us, but we also just feel like better veterinarians because we're doing advanced level care. We're making a bigger difference than we ever used to in pets' lives. So they're surviving this critical illness much, much better. And it may be the difference of someone saying, my dog has a sudden bleed in its abdomen and spleen is ruptured. The surgery is this much, but you know, there's a 67% chance that this is metastatic cancer, a 33% chance it's benign. It's going to cost $4,000 to $6,000 to get the answer, and we may end up losing them at the end. It's worth trying when you have insurance. And there's also ancillary therapy that if you have insurance, if it is metastatic, chemo, you can afford it. And so it makes a big difference. And then covers alternative and holistic treatment options provided by a veterinarian. So as long as the veterinarian is providing those ancillary services like Dr. Langton, it's covered in most cases these days. So you do have to look at your policy and make sure that applies, but usually it does. Cons, the biggest one that concerns people, you may not use the money. I'd love to have that as a con. Perfectly healthy patient, has no problems, but you still have peace of mind if something were to go wrong. I don't want your pet to be sick. I want them to be healthy. I don't want to see them very frequently. I'd love it if I know a bunch of people in here because the people in here have pets with problems. And so insurance would benefit them in those situations. But fact of the matter is that most of us, if you're a very proactive client with your pet's health care, you're going to use it. Paperwork, oh boy, paperwork. I hate paperwork. So there's paperwork involved in insurance, and so you have to make sure that you're on top of it. There's claim submission forms. You want to check the status of your submission. We'll go through a little bit more of what this paperwork is. Denials happen. I say VPI. I've written so many appeals for VPI. I hate writing appeals because they won't let you just call and talk to them. You have to make it a written letter, and it has to be a formal part of the medical record. But I always do them when a denial happens, and I always try to get that denial reversed. I would say the great majority do get reversed, and so the claim usually does go through. It's just a hassle and a headache. I'm going to give you one example right now at this point, though, and it's a boxer named Thor. Thor had VPI pet insurance. Thor came in suddenly unable to urinate. So he was trying to pee, but nothing was coming out except for a few drips of blood. Thor had a stone lodged in his urethra. He needed emergency management or else he would die. He was in a lot of pain. So we put him under anesthesia. We flushed that stone back up in the bladder. Now the reason Thor had the stone in his bladder is very complex. He had a prostate. He was not neutered. His prostate was about the size of a cantaloupe. Big prostates do not being neutered. By the way, they'll shrink right down if you do neuter dogs. But big prostates get infected. So he had an infection in his prostate gland, which led to an infection in his bladder, which led to infection-based stones in the bladder. And then one of those stones tried to get out, and it couldn't. And so it got lodged in the urethra. The owner opted, because Thor was 11 and he didn't want to put him through it, instead of doing a cystotomy, which is where after dislodging that stone and pushing it back up in the bladder, we make an incision. We go in, we open up that bladder, we take the stones out from the inside. He didn't want to do that surgery because his dog was 11. He had VPI pet insurance, it would have been covered. We opted instead to treat the infection-based stone with antibiotics, a stone-dissolving diet, and he had to come in for repeat x-rays, repeat urine cultures. He had to get some care for 3 to 4 months. And over that time, and the stones did dissolve, the infection went away, his prostate stayed nice and big because he wasn't neutered. But over that time, he spent $1,500 for that care. VPI covered $300. And the reason was because it was a medical problem. If that owner had opted to do the cystotomy, they would have covered 90%.
And how much would that have cost?
About $1,500 for the cystotomy.
So pretty much the same
About the
thing.
same. Yeah, it would have been about the same, and it would have been covered, and Thor would have felt better sooner with surgery. Surgery is the treatment of choice, the recommended treatment ideally when there's stones present. And because of EPI knows that, and they think that proper pet care involves surgery in that instance. They cover surgery very thoroughly, but they do not cover medical management as the so they won't supplement. And it's in the policy, it's spelled right out. There's a whole paragraph about it, and you can see exactly where his coverage failed. And had he looked at his policy before making that decision, he might have opted for the surgery. We could have neutered him at the same time and ended up with a shorter process. That would have been nice. But, okay. Another con, again, the pre-existing conditions are not covered for most policies. So if there's something you already know is a problem, you can't then go and get coverage to pay for it. And then not all veterinary clinics proactively fulfill claim requirements. There's some clinics that just absolutely consider pet insurance to be a big pain in the tush. They don't like dealing with the paperwork. They don't like that the clients may put some demands upon them. It's getting less common that that's seen. But if you really, really love your veterinarian, you're not going to leave them, but you do want pet health insurance, and that veterinarian just doesn't like it, you need to have a candid conversation with them about it and see if they're going to help you with that process or not. And then food is not covered on most plans. One of the reasons Thor's reimbursement was so poor, the stone dissolving diet was not covered. And so it's a big part of the management of dissolving stones. You have to feed them a special diet for that to happen. And so therefore, that's one of the reasons he only got $300 back. One of the nice things about Pet Plan though, and Pet Plan is officially my favorite insurance plan. They cover food specifically meant for stone dissolution. So if your dog has chronic crystals, if they have grit, or if they have true organized stones, they'll pay for that, which is the most common reason to lose prescription diets.
Would that also go for cats with kidney?
Kidney failure, no. But if they form stones or have stones in their kidney and you're using a diet for that, that would be covered. And then again, care not provided by a veterinarian is not covered, so it has to be under the purview of a veterinarian. And then getting dropped or excluded. The biggest time you're going to get dropped, if you have a lot of claims and you allow a lapse to occur. So if you don't pay your policy premium and there's a lapse in your payment, you can open yourself up to being dropped. Otherwise, it doesn't really tend to happen. I have seen, and again, I pick on VPI because I've known them for a long time, and it was one of the reasons that I didn't like pet insurance, because their coverage they just had all these strings attached, but they love exclusions. So after a year of inflammatory bowel disease, they know there's going to be ongoing costs. You have to look at your policy. It'll be spelled out in that 10 to 20 page document. They may opt, if costs are a certain amount, to not cover that problem anymore. And another way that companies can sometimes deal with that is they have a per problem maximum. And so after you go above that maximum, you may not be covered. Okay, so this is Nina. She's beautiful. She's a 7-year-old female spayed black lab. And Nina came, the reason Nina had pet health insurance is because Nina got a new brother named Zemi. And Zemi, we were talking about pet insurance, and when Mom was investigating pet insurance premiums and plans, she opted to get health insurance for Nina as well. And it ended up being a really lucky thing. Her policy per year, she got the policy when she was 6. It's about $400 a year. It is pet plan insurance, $200 deductible, 80% reimbursement. So the plan had been in effect for several months, and she went kenneling because her family went out of town, and after picking her up from the kennel, her belly was suddenly very big. She was very lethargic, had GI disturbances. I saw her in exam room splayed out on the floor, her gums were white, and her belly was full of blood. And I had that unfortunate scenario of sitting down with Mom and saying, if we don't do surgery right now, she's going to die. And so we need to afford a several $1,000 surgery and aftercare for her. And luckily she had pet insurance. So Nina was operated. It was a ruptured spleen. It was actually 6 pounds 5 ounces, about that big around. My assistant was holding it, and she said it felt like a bowling ball because her fingers kept delving into it. They're usually very friable, which is why they rupture so frequently. So anyway, that it was taken out. She did later, we got her biopsy results back, and her splenic tumor was benign. She's cured. And so we did not have to make an unfortunate decision due to finances, and she has the best outcome possible. She's not going to have any more problems with that spleen. The bills were just under $4,000, and with a $200 deductible and 80% reimbursement rate, they got $3,200 back. And again, her premium is $400 a year, and we anticipate using it more because she's 7 now, and 7 is when statistically more problems start to happen: osteoarthritis, dental disease, all the chronic medical conditions. She has medical level coverage. She's doing great. Okay. Are you the type of pet owner that will benefit from pet insurance? And I already know the answer is yes for most of you. I know most of you. So the questions you have to ask: can you afford an extra monthly payment? So can your budget fit it? At the same time, you have to ask the question, can you afford a balloon payment of an emergency? If you can afford a small monthly payment but can't afford a balloon payment, pet insurance is for you. Can you stay up to date on the payments? prevent lapses in coverage. If you're notoriously late on bills and you end up with lapses, you might end up getting dropped, or inevitably that emergency is going to happen when you have a current lapse. It just seems like that's the way it goes. So just have good follow through. A lot of them do let you set up for automatic monthly payments, or you can pay a year at a time. And you can have your credit card on file until that credit card expires, and then you have to go renew it. And then, are you going to follow through on the submission paperwork, follow up on your claim status, and be your own advocate in the appeal process? So when you get a denial, you're not informed of that. You are. And then you have to forward that information. You have to give us the reasons. Whatever money, they will not reveal to us whether you've been approved or denied. They also won't reveal how much money you've gotten. You have to forward that information to us. You have to be your own advocate. You have to help us understand it. You have to bring in your policy or the informed appeal. And again, most appeals ultimately work. They're just a hassle. So we want to do what we can to avoid a denial from happening. Do you tend to comply with veterinary recommendations? So if your veterinarian says, oh hey, it's definitely time to get in there and clean these teeth, do you do it? And are you one that wants to do it? If your veterinarian recommends dental care and you don't take the recommendation and you don't do it, when a tooth actually gets to the point where it's rotten and abscessed a year later, they won't cover the abscess at that point. If you comply with recommendations every step of the way and you're doing those regular dental cleanings along the way, they will cover periodontal management. So coming in for dental cleanings is covered by pet plan as long as you're staying ahead of periodontal disease. What they will cover, if there's a fractured tooth, if there's a cavity in a tooth, if there's an injury in the mouth, a mass in the mouth, then dental work will be covered no matter what. So those things are always covered, but periodontal disease, standard dental cleanings for gingivitis and calculus, those are only covered if you're being proactive about it. And so it's a way of ensuring good pet care, which makes us happy. Do you find the highest level, highest quality of care to be a high priority? Are you looking for that extra safe anesthetic experience for your pet? If it's important to you, people choose or even leave veterinary practices for one of two reasons. They're looking for cheaper care or they're looking for better care. If you're the one that's constantly looking for higher quality care, pet insurance is going to be the right type of thing for you. So are you interested in those MRIs? Are you interested in seeing an internal medicine specialist? Are you interested in seeing a surgeon for a more complex surgical problem? If you want those options to be available to you and to be affordable to you, pet insurance really helps. I will also say this. Let us help with the insurance claims process with the surgeon or whomever you go to see. A lot of times they're actually not really good at doing insurance forms. And so when I refer people out, I'm like, don't let them fill out the form. I'll fill out the form for you and you go get the signature from them. It will work better, it will go through better with people that are more familiar with insurance. Do you tend to take your pet to the veterinarian on day 1, maybe 2 of a problem, or you one that kind of sets back and waits to see if it'll self-resolve? People with pet insurance tend to be the ones that go in early. So all of a sudden there's a yelp and a limp and they're here at the vet office. It's nice. We definitely are much more successful if we treat problems as soon as they start rather than waiting until they get bad. Number one problem that this applies to is blocked cats. Oh, blocked cats. I saw one today, had been blocked 4 days. We had no choice but to euthanize that cat. That cat was not going to survive. It was day 4 of a problem. That's deadly. Blockage is deadly in 3 to 6 days. We need to see them day 1. We really need to see them within 24 hours or they're going to hit kidney failure. They're going to have abnormal potassium, abnormal heart rhythm, low body temperature. They're going to die. So we really need to see them early. And it's when they're straining in the litter box and you're not sure if something's coming out or not. That's when we need to see them. Pet insurance helps us take care of this problem and see them early. And do you prefer non-veterinary care methods? So it goes back to that question of Reiki and massage, chiropractic care by human chiropractors, those kinds of things. Those are expensive, and they really can add up, but veterinary pet health insurance won't pay for it unless it's through a veterinarian. And then would you prefer to make a pet health savings account? And that's where you make a monthly payment to yourself into a savings or checking account just for the use of your animals. This may be more appropriate for people that have large numbers of pets. And so it may be more beneficial if instead of paying for, say, level 1 health insurance that might be $15 a month for 4 or 7 or however many animals, you might take that $15 per month per pet and instead put it in a bank account. Because this is all measuring risk. And so how often are you going to have those big expenses for each of your pets? Depends on the type of pet owner you are and how often you take them to the veterinarian. But if you do tend to wait until there is a problem to seek some care, pet health savings accounts are better. And then, do you have a veterinarian that sees pet insurance as a worthy entity or purely a hassle? And so it's really beneficial when they are your advocate with insurance. Okay, case number 2 is Micah. He's hanging out back there. Oh, Dr. Valancourt has him. Micah's adorable. He's a 2-year-old Morkie, so he's technically a monster dog. His house is cheaper. He he eats things he shouldn't. He eats lots of things he shouldn't. He had a $20 bill last night. He vomited them. It was like, how do you use a $20 bill? I would not lose 20.
Hey, now you're blocking the screen.
Hi, Micah. So, Micah eats all kinds of stuff. I mean, all kinds of stuff. Even when he was neutered, he had an upholstery staple stuck at his ileocecal junction on his routine orthopedic screening x-ray because he chewed the skirt off of an upholstered chair. But he eats everything, don't you?
Yes, you do.
So anyway, he had foreign body surgery when he was about 20 months old. And when we were in there, opening his stomach and his intestines, we had noticed a lesion on his tongue that had not healed since he cut his adult teeth. And we thought it was an eruptive ulcer. So when dogs are cutting their teeth, there's these jagged edges on the puppy teeth that can cut the tongue. And so those ulcers can get infected and become an issue for a couple or few months. They usually self-resolve. We don't even usually use antibiotics. But at 18 months, so a year after those teeth had been erupted, he still had an ulcer. So I decided, well, we're in here. We have pet health insurance. It's actually going to be no additional cost to the owner, because the deductible's already met, so let's biopsy that area of the tongue. And Micah was unlucky enough that came back to be a mast cell tumor. So he had a diagnosis of cancer at 20 months of age. So then after he healed from his foreign body surgery, 2 weeks later, we resected a portion of his tongue. And we took that tumor out of his mouth. And then tongue works just fine, by the way. It's a little it's curly cued, but it works just fine. I still get lots of kisses.
He's just saying thank you.
Yeah. I smell really good today. And then he got his stitches out of his tongue, and he had to have a laceration repair. He had 3 surgeries in 4 weeks' time. He also saw the specialist, had some additional testing done, a lot of management. He also had some other barium swallow studies because he ate other things he shouldn't have, that those did not result in surgery. Anyway, Micah cost $12,000 in 1 year, and Mom got $11,000 back. His premium is $350. So Micah has really benefited from pet insurance. He's also currently cancer-free. We've also re-biopsied his incision to make sure there's no recurrence of mast cell tumors like to recur in the site where they once were. His 6-month biopsy is clear. Biopsy is paid for. Mom has a $100 deductible, 100% reimbursement at $23 a month. So he's really benefited. Brother back there, Elijah, he's healthy and working. And so he hasn't benefited as much from insurance. The other thing is that know your waiting period. No one wanted me to mention this. She came in on day 12 of having the policy, and they both have anal gland infections. So anal gland infections will not be covered for their entire lives because she came in and it was diagnosed in their waiting period.
2 days early.
2 days early.
And that's it, you gotta read it.
You gotta read it, you gotta know your policy. Although, if they're having a problem, I recommend that they come in. But if they're completely asymptomatic, wait through your waiting period before you come in. If they have no problems, there's no reason not to wait 14 to 30 days. Okay, and what to ask the insurance company when you're shopping. Is the premium fixed for the life of my pet? Now, there's pros and cons to this, actually. The nice thing is, if it's a fixed premium, we're going to go up and you know what the numbers are going to be for the entire policy. But if it's not fixed and it increases with age, it can be awfully cheap those first few years. And so you may encounter a lot of problems and they end up being covered for a minimal investment. It's just you don't know how high they're going to go. If you look at the language in the policy, you want them to maximize, say a maximum increase per year percentage-wise. You want that to be listed in there. So there can be benefits, and their health care definitely gets more expensive. As dogs get over 7, cats get over 10, they definitely cost more. They have more problems. And so you might be okay with it being an increasing policy rate every year. Is the deductible per problem or per year? Per problem deductibles are definitely better for chronic medical conditions. So this would be if you get medical level coverage, you probably want this. So if your pet gets inflammatory bowel disease, they're going to have it for life. They're going to be on management for life. You definitely want a per problem type deductible for that type of situation, but you don't know it ahead of time. And then the per year. So no matter what problems they have in a calendar year, you pay one deductible and then you're done. I'd say generally I do prefer the per year, but there are instances where this is really helpful. And then maximum benefits are they per problem? Are they per year or lifetime? This is really important to know. Actually, Jordy, who we're going to talk about in a couple minutes, she reached a maximum on IBD, right? And so she's on chronic medications for IBD and FIC, so inflammatory bowel disease and feline idiopathic cystitis. Both medications have to be monitored with full blood work and urines twice a year. We reached the maximum on IBD, so we claimed the blood work under FIC. So it's very beneficial to know your policy, because if I didn't know that you reached your maximum, because I won't be keeping track of that, you know it, you let me know, and I can submit it under the other chronic medical condition. So this is an important feature to know about. And then is there a maximum per year, and what's the maximum payout per lifetime? Sometimes they're all there in a policy, and you just want to know what they are. Is there a fee schedule? Fee schedules are horrible. I do not like fee schedules. VPI is the only company I've seen this with. I'm sure there are others. But what a fee schedule is they take every item on an invoice and they have a price that they consider a reasonable and customary fee. And so the way they determine that is the average veterinary cost of a certain diagnostic. So if the national average for an x-ray is $100, I'm doing that for the ease of math, and your reimbursement rate is 80%, but say the actual cost at your clinic is $160, they're not going to reimburse 80% of $160. They're going to reimburse 80% of $100 because that's their maximum acceptable fee for that test. These are just awful. And so they can really take a problem that costs a lot of money and make your reimbursement pretty small. What is the wait period for coverage to kick in? Just know that. So again, if you have a 14-day or 30-day wait period, it depends on age and the company that you're with. If they're not having any problems, please wait beyond the wait period before you come in, because it's not uncommon for us to diagnose a problem that you don't know about, like a broken tooth or a lump that you didn't notice. And then all of a sudden there's a problem and it's in your 14-day waiting period and it's considered pre-existing. So if there are no problems, if your pet is fine and status quo and happy, wait until the wait period is over. And then is there a wait period between events for recurrent conditions? So foreign body surgery, some policies will not cover foreign body surgery twice in 6 months. So you have to wait 6 months before another event before they'll kick in that coverage. Pet plan has a quirky thing with this. They won't cover the same foreign body twice. Not the exact same foreign body. That would be really bad luck. But they won't cover, for example, I know a certain little pit bull that has eaten his mom's long underpants 3 times. Like, stop wearing butt floss, but whatever. They would only pay for the first thong.
Oh, they're really
If they had pet plans. She actually has a different insurance policy. I actually got it for her because she's a technician at a friend.
I have a question. Did she not know that the dog swallowed it?
She knows because I take it out in the OR and I hand it over to her and I say, I see your panties.
Well, I guess
Is
like
this embarrassing?
catching the dog in the van in advance. I mean, couldn't vomiting have been induced, or was it too late?
No, she didn't know. She didn't know he ate her under.
Okay.
He digs through the dirty clothes hamper. He'll knock it over, he'll pick out what he wants, and it's always the butt floss. He loves it. He's a sweetheart, and I love getting kisses from him, even though I know what he chews on. Is specialty level care covered at the same rate as routine veterinary care? In most cases, yes, but actually with pet plan, no. I love pet plan, but specialty level care is covered at 1% level lower than standard veterinary care. It's still really good coverage, and I'm sure the reason that they do that is because specialty level care costs more, and so it reduces some of their costs. It's in the policy, you'll see it.
What is an example of that?
So, Nell has a good example of it, because Micah went and got an ultrasound with an internal medicine specialist associated with his cancer staging. And so he had all of his surgeries here, but went to the ultrasonographer for staging to see if the lymph nodes were enlarged, the spleen was enlarged, other things where mast cell disease can spread to before his second surgery, so I knew if they had to remove anything else. And so they paid, she has $100 deductible, 100% reimbursement. At specialists, she has 80% reimbursement, same deductible. So she got 80% of that test covered. And then what happens if you don't comply with medical recommendations? So actually there's an insurance company I'm not too familiar with. I have one client that's using it. He's actually an insurance broker himself, so he found it and it's quite cheap. But I don't recommend it because they have all these exclusions. I recommended that their dog be spayed at 6 months of age, and I put that recommendation in the medical record. And because that recommendation was prior to him getting his policy, now that he doesn't want to spay, he doesn't think it's indicated despite all of our discussions about the reasons to do spay surgery. So they will not cover, if she's not spayed, they will not cover treatment for pyometra, which is infection of the uterus, and they will not cover anything associated with breast cancer. So the reason that we all recommend that female dogs be spayed prior to 6 months of age is because the incidence of breast cancer in unspayed females is 1 in 4. And we know we can prevent breast cancer by spaying dogs, so that's why we talk about it a lot. If females are not spayed, we find lumps in 1 in 4 of them. And pyometra will happen. If a female is not spayed, eventually it's just a question of time, and if nothing else gets them first, they will develop a toxic uterus, and they will need immediate surgery or they will die. And we do that surgery at least several times per year. Insurance may not cover it. You have to look at the fine print. If you don't comply with the recommendations of your veterinarian, they may not cover it. UTI management, I've seen a denial because we recommended a culture be performed after antibiotics were prescribed to ensure the infection was gone. The client did not comply with a second culture. The urinary tract infection actually never went away, so we found on culture about 2 months later when the dog was symptomatic again that the dog had the same bacteria with the same sensitivity profile, so it was the same infection. Because the client did not comply with the follow-up recommendations, they did not cover the infection the second time. It should have been treated properly the first time in there. So are you the type of person that takes the recommendation and follows through? That's There's Jordy.
What a
Look
beautiful
at her.
cat.
She's awesome. She's been a train wreck. Fantastic train wreck. She's had problems since day one. So Jordy was adopted as not even a 2-pound kitten. She had been spayed at that point. But she was failure to thrive right out of the gate. And Robert was traveling.
Yes,
He's always
that's my
traveling
home.
whenever there's some major issue going on in his household. This is Kaylee over here.
Oh, yeah.
Anyway, so Jordy was failure to thrive, severe URI, severe diarrhea, non-responsive to medication and management. She needed a lot of support, and she had a gift policy because she was adopted from a shelter. And they covered $500 per problem. She had 2 problems, so we got $1,000. I read over that policy really well to make sure I submitted 2 problems so I could get $1,000 of coverage for this owner, and it worked out very well. It really supplemented the cost of her care. They then lengthened the policy through 24-hour pet watch, the same company, because she would have otherwise had pre-existing conditions, so they stuck with the same plan. And then she got stepped on and fractured a bunch of ribs and got flail chest. So she had an emergency shortly thereafter while she was still only like 3 pounds.
It was right after she got rid of the upper respiratory
Yeah,
infection. Her
right after
first
she got
day
better.
of freedom. Literally her first night of freedom.
Right after she got better.
Yes.
She got stepped on, and because she was so little, and she came out from under the couch, and you just can't see them anyway. She got stepped on and fractured a whole bunch of ribs. Needed a lot of pain medication, recheck x-rays, a lot of care. That was covered. Then she developed inflammatory bowel disease. That diarrhea from a kitten never went away. So she needed a colonoscopy and diagnostics and treatment, and she's been on that ever since. And then she developed feline idiopathic cystitis, so inflammation of the bladder. And so she's needed chronic management for that. Special. Do they cover your food?
They covered the food initially up to a limit.
Up to a limit. So 24-hour pet watch did cover the food.
Exceeded.
Yeah.
We exceeded the limit, yes. And so we have to know how to submit, and in fact, Robert's actually the genius at submissions. Oh, yes, I do. Actually, I've learned a lot through Robert because of the way he does his submissions. I learned through you.
We want to get every penny.
Yeah.
Not that we wouldn't spend the money anyway, because we've had 4 cats and privileged of Dr. Leach take care of 4. First 2 we didn't have insurance, and we kind of woke up, and then we decided Jordy needed insurance, and fortunately we did.
Yeah, because she's used it, every penny of it.
Oh,
Our other
yeah.
cat, Kaylee, does have insurance as well.
And she hasn't used it.
She's had
One claim.
The little eye thing, that was it.
Yes,
Yeah.
one claim for
Nothing.
Kaylee.
Yeah.
But you can
So-
tell we love our cats because this is our bed. Sue sleeps with the cats. If there's room, I sleep on the bed. Otherwise, I sleep on the floor. That would disturb them.
Medical conditions with Jordy, and we hit the maximum on IBD, and so we submit her monitoring blood work for the medications for both problems under FIC because we haven't hit the max on that yet. And then she just recently ruptured her cruciate ligament and needed orthopedic surgery. I came in on my vacation
Yes.
and operated her leg.
Hallelujah for Dr. Leach.
Well, and Heather was a big help
Yes,
too because
Heather.
she came in on Sunday with me in order to see Jordy right before I went to Disney with my family, and so she's doing great.
She's actually out. Last night she slept with us in bed, and she is out. She has a room at the house in 6
Awesome.
weeks. And
I saw the Facebook post.
yes, yes. I was hoping you were going to say, no, not yet. But she's doing really,
No,
really
I-
great.
Yes.
Yeah.
So she's doing great. She actually is also a case that had an ancillary therapy that was covered. She had cold laser therapy after her cruciate surgery, and that will be covered by 24-hour pet watch. I think that's the only thing you have that's still pending.
Yep.
Yeah.
And ultimately, you tell me the numbers because you know them better.
Okay, Jordy is 9, just to give you an idea of age. Over the course of her life, in 9 years, we've made about $14,000 in claims. We've been paid about $8,000 because we had it was a 70%, so we had to pay 30%. Premiums were shy of 2,000, so net we were ahead of game 6,000. So for us, it really has benefited financially. But I want to go back to saying, first and foremost, when we decided to get the insurance, it was more of an emotional thing. When you think of your pet as always giving unconditional love, so why would you not give them the health care they deserve? And it was really, for us, a no-brainer. And what kind of pushed us to trying the health care, because we were a little bit hesitant. We went through the same thought process that we saw today, was it was really not very expensive. The premiums are about, for her was $230 a year, and that's where they are today. And we have, for her, we have 24 Pet Watch. For Kaylee, our cat in the back, we have Pet Plan for her. And we went to Pet Plan because actually Pet Plan we felt was better coverage. And I think that's the policy of
It is the one I like a lot.
But we couldn't get Jordy off of Pet Watch because of the pre-existing conditions. So
You have to stick with it. Yep.
That's where we went today.
Yeah, when you switch, you then can reintroduce pre-existing conditions, so. Okay, wellness plans, are they worth the cost? I generally say no. There are exceptions, but you can actually do the math and see if it works out for you. These cover annual vaccines and examinations, heartworm prevention, flea prevention, all of your standard stuff that you're gonna do anyway. And it can supplement those costs. Usually, you just are adding additional paperwork and steps in order to get your money back for something that you were gonna do anyway. And so in many cases, you're simply prepaying for services that might even cost less if you paid out of pocket for them. And then we just consider distemper shots, heartworm tests, fecal samples. Those are just part of the cost of pet ownership, not really an insurable risk. There's no risk. You're gonna do these things. There are exceptions, and the biggest exception I would say where wellness plans are worth it is giant breed dogs, because their monthly flea and heartworm medication, they often need 2 tubes of flea medication and 2 pills of heartworm prevention, because there's costs so much, it's $60 to $80 a month just for their preventatives. They have much more cost, and then wellness programs can be beneficial more than that. But you have to look at the numbers. And then I just wanted to put in here 2 slides, streamlining the claims process for your veterinarian and then for you. So for the veterinary staff, computerized records greatly increase efficiency of the claims process. You stick your diagnoses on there, it's super fast. By the time you're at the front desk with your pet, a lot of times everything that's needed, you don't have to even write your diagnosis on the form directly because your diagnosis is on the invoice. And so it greatly increases efficiency. With paperless practices, it's no big deal to keep the whole insurance policy on file here. We can scan it in if you bring the hard copy in our machine and attach it to a line item on the computer and have no paper. And then we have a backup for you as well, and then something we can refer to if there's a denial. Keeping the insurance company and patient number, your policy number on file, very beneficial if we have that. Keeping claim forms on file, this is very helpful. It really speeds things up. Claim forms that are pre-signed are even better. I'm sure that's not quite ethical, but it is very beneficial to have these on file. And then using succinct diagnosis codes. Probably the best way to submit something like Nina's would be chemoabdomen. So having blood in the belly and not being very super specific. And a lot of times, I mean, sometimes you do work under a working diagnosis and eventually put in a final diagnosis once all your testing is done. But for example, for a pet that is drinking and urinating a lot, you might be talking about Cushing's disease. You might test for Cushing's, and you submit that claim for that test for Cushing's, even though the test may be negative because you're working up increased thirst and urination. And then your final diagnosis may end up being something like diabetes insipidus, and you file future claims under that. Now, with per problem coverage, per problem maximums, per problem deductibles, I mean, we can make this work for us, or we can have problems. We have to try to look at the way your policy is structured. Wording is key. This is something I'm getting very good at because, for example, routine dental cleaning, you can't call it a dental prophylaxis anymore because they won't pay for routine dental cleaning. What they will pay for is periodontal disease treatment. So we're technically, anytime we do dental cleaning, there's gingivitis. 85% of animals have it. They have deep pockets. You know, they have problems that we're treating under the gum line, and we're doing root planing. We're using that ultrasonic scaler that has water flow to keep it cool under the gum line. It's safe to use under the gum line. We're not just scratching the teeth clean with a curette. So it is periodontal disease treatment, and as long as you word it that way, it'll be paid for. The other thing that we run into with Jordy, and Robert is so good at checking and making sure I do this properly, you can't put wellness exam. Because if it's a wellness exam, it won't be covered if you don't have wellness coverage. She's coming in for chronic disease management, so we have to say veterinary exam, or else it won't be covered. So wording is really key. We try to avoid the word wellness on insurance claims. And then try for immediate claim submission. So I recommend vet practices try to do things as quickly as possible, and then get better and better at that. Okay, and then streamlining the claims process for pet owners. Know your policy, read it, be familiar with it, be able to explain it to the veterinary team. So it just really hastens the claim process when we know how to submit something. Consider getting pre-approval based on estimates for service. So you can actually take the estimates that we give you for things that we're recommending. You can fill out a form with your insurance company and send it, and they will tell you how much of that bill will cover. Now, estimates give you a range rather than an actual number like an invoice, but that's something that you may want to consider doing so you know, you can see if any of those pitfalls are going to happen. But they generally do pretty good. And these actually usually encourage people to do the procedure rather than discourage. So I find if people go through this process, they're more likely to have the surgery done, whatever we're recommending. Again, know your wait period. So if your pet is healthy, not having any problems, wait until that's over. Know the timing of coverage for monitoring chronic medical conditions. There are some policies that do lay out for medication. They will cover a maximum of twice yearly blood work to monitor that medication. So it'll be spelled out for you in the policy. Bring submission forms to all appointments, have them signed, have them ready, and we'll do that for you, hopefully. And especially if you're at another vet practice besides ours. Be prepared to submit all the forms yourself immediately after your visit. So if you go elsewhere, have maybe even a stamp and an envelope ready so that you can stick it in the mail as soon as you're done. We do ours electronically, but if you go elsewhere, I don't know what they do. And then a note about fraud. They're getting more and more keen to fraud. So when policies are started, they ask for 2 years of records if they've been alive that long. And they'll go through and they will try to find all evidence of pre-existing conditions. And it may influence your policy rate, and it may also influence exclusions. So they may say certain problems are excluded. So if your dog has hypothyroidism, they're not going to cover it with the policy. And this is why there are waiting periods. It's to avoid fraud. So if your dog is limping and you know it's going to need x-rays and pain medication and workup and possibly surgery, if you sit at home and enroll for a policy and then go in for that problem, you know, most people with a severe lameness in a dog, especially if it's a fracture, they're not going to wait that 14 days. The animal needs care before then. Let's hope.
May I add something to your first bullet point?
Yeah.
One of the things that I noticed with the insurance that we have is that they will also ask for the medical records periodically.
Yes.
During the course of
Treatment.
treatment. We'll get into details. In some cases too, and I believe it's for pet plans, this is where it's great to read the condition, is that they require that you prove that you've taken your pet to the veterinarian at least once a year for a regular
Yes.
checkup. So if you don't go regularly and all of a sudden you complain, they say, well, you violated the conditions.
Yeah.
It's not a picky thing, it's a good thing.
Yeah.
You know, to go at least once a year, but they will look for that.
Yeah. And then veterinarians are not going to alter or falsify records to hide a pre-existing condition. Don't ask us to do it. We won't. And then we also will not change our recommendations. So for that client that wanted me, they actually wanted me to change my recommendation and say I didn't recommend that their dog be spayed. It's just not true, so I'm not going to change my recommendation. Use an insurance broker. Veterinary medical records are not as universal as in human medicine. So right now, this oversight is going to be coming. They're going to start doing more oversight. But if you have a regular veterinarian with your pet, automatically they get a little more suspicious if your pet is older. And you get a diagnosis. You go home, you buy a policy, you wait your waiting period, and then you go to a different veterinarian. We haven't yet gotten calls to see if we've had a patient registered, but expect them to do that. And there are some policies that say they will count. And they may become a requirement. And the issue here is patient identification.
oh, I want to surrender this animal because it has all these health issues, and so that I can get insurance, and then you turn around and try and
Readopt it.
readopt it
Yeah.
and change its name, or, yeah.
Yeah. The other thing is if you have two poodles from the same litter, same sex, they may look very similar. And someone might try to get one insurance policy to insure both dogs and bring them in alternating. That's what this is for. So,
Now, what do you do, okay, in the situation where they're asking for 2 years prior medical records? What happens if you just adopted a 4-year-old dog?
they just look at the shelter records, usually. So, and they may, in that instance, if there's questionable history or no history available, they may have a longer waiting period for you. So that'll be tailored based on what you've got going on.
And you might not get a lot from the shelter. You
No,
might get minimal, like they've had
Information.
the distemper shots and they've been treated for fleas and worms and.
right.
Or me who just picks my cats up off the street?
Right, right. So if they've never had veterinary care before, they often require that you have an exam within the waiting period. They often do. So that they can see what the pre-existing conditions are. And then the big picture, insurance, it's meant to ensure that your pet receives the care they need during an unexpected catastrophic event. So that's what it's really for, is it being able to afford that big, big problem. It's not for everyone, but with the right information and asking the right questions, you can determine if it will work for you. We hope that this information helps prepare you for those questions that you're going to ask of insurance companies. And we encourage you to engage in conversation with clients that are here today that have pet health insurance. So the 3 examples that I used, all of those pet owners are here. And then I also have personal information about other claims if you have any questions. But thank you very much for coming. I really appreciate it. I also want to thank Joanne. She really helped me put this together. She helps me plan stuff. She's awesome. If you want a tour of the facility, we can do that too. And do whatever you want. We'll be around for the next hour or so. Any questions?
Dr. Leach, if you have any, you said that generally a purebred has a higher,
Usually.
what if the mutt, what if part of that, whatever the mutt is, what if they have, if that breed is known to have health problems?
You mean if it's like a Boston Terrier?
Exactly,
Cross?
right.
If it's a cross, it won't be a higher,
Okay.
it won't be a higher premium.
Okay. Do they give multi-animal discounts?
Yes.
They
Like
usually do.
multi-car discounts?
Yeah.
Okay.
Yeah, which
Okay.
does make it more affordable for multiple pet households. They know that households that have lots of animals have a hard time affording a
Okay.
number of policies, so it does
Right.
get cheaper the more pets you have.
Okay.
And some are better with that than others, so you call around and get prices.
Okay. All right. Thank you.